It appears tomorrow is the day consumers, healthcare providers, and insurers have been waiting on for months. The U.S. Supreme Court is likely to hand down its ruling on the federal health care law. RTV6 reporter Norman Cox has been gathering opinions about what to expect and what will happen next. Norman.
Predictions from experts are all over the place. Some believe the court will throw out the whole law. Some say it will uphold all of it. But most believe it will overturn portions, particularly the mandate that all Americans must buy health coverage, something conservatives have attacked relentlessly as a constitutional violation.
Perhaps the biggest impact in Indianapolis will be on WellPoint, but the giant insurer wasn't talking today and said it would comment tomorrow after the ruling. Some legal experts say the individual mandate is too big a constitutional stretch of the federal government's ability to regulate behavior under the Interstate Commerce Clause. But IU law professor David Orentlicher, a constitutional expert, believes the court will uphold the entire law. He says the mandate can be compared to the existing requirement that all Americans enroll in Medicare.
Medicare is a critical example because think about Medicare. What is Medicare? Medicare is a mandate for us now when we're younger than 65 to pay for our health care insurance, so when we reach 65, we'll have health care then. That's a mandate. We do it through a payroll tax.
If the mandate is overturned, Orentlicher says that will be bad news for other popular but expensive features, like the one requiring coverage of pre-existing conditions. He says allowing some people to opt out of coverage will make that feature too expensive.
And that's not fair to allow people to game the system. It would be like saying to people, you can wait till your house is on fire to buy your homeowner's insurance.
So if they throw out the mandate, the pre-existing conditions clause is probably in trouble.
I think so.
The head of the Indiana Chamber of Commerce says business doesn't know what to prepare for. He believes if the mandate is thrown out but other requirements remain, that many companies may wind up dropping insurance coverage completely.
The whole incentive system is for business to drop coverage and pay the penalty, because in most cases the penalty is far less than current coverage. And it's almost, there's a conspiracy theorists who think that it was done that way as an intermediate step towards universal health care.
And some people are envisioning a possible nightmare scenario. The court throws out the mandate and the Republican House refuses to replace it with anything, but the Democratic Senate refuses to remove the other provisions that then couldn't be paid for. Live in the newsroom, I'm Norman Cox, RTV6.